Hello everyone. Today we're looking at medications that help your lung condition. There are three main forms of medication that you can take for your chest condition. 1. Inhalers, 2. Tablets, and 3. Nebulized therapy. When we're looking at inhalers, the two main types of inhaler that you will come across are dry powder inhalers and metered dose inhalers. The types of drugs that we get in these inhalers, however, vary greatly. Relievers or short-acting bronchodilators such as salbutamol, salmeterol, formoterol and Ventolin work by stimulating beta-2 receptors in the muscles that line the airways. This causes them to relax and allows the airways to widen or dilate. We call them short-acting bronchodilators as they work very quickly within a few minutes. Preventers or long-acting bronchodilators such as Atrovent, Spiriva, or Aclera Genuair work by blocking the muscarinic receptors from the neurotransmitter acetylcholine. This helps the muscles around your airways to relax, keeping them open to reduce your breathlessness. We call them long-acting bronchodilators because their effects can last for up to 12 hours or more. Inhaled steroids such as budesonide, pulmicort, Qvar, Clenil and fluticasone work by suppressing inflammation and swelling in the airways. However, combined inhalers such as Trimbo, Trelegy Ellipta, Anoro Ellipta and Duaclea Genuair contain more than one drug in one device, which helps to save time as there's only one inhaler for you to take and only one technique for you to learn. This in turn means that you will be more likely to take it correctly and regularly. So, which inhaler should I be taking and why? Well, when choosing an inhaler, drug and device, the following things must be taken into account. 1. How severe is your breathlessness and does it affect your activities of daily living? 2. What are your lung function results? And 3. Will you be able to use the chosen inhaler device correctly? Spacer devices have one way of making sure that you use your inhalers properly, but they can only be used with metered dose inhalers and are usually provided to help improve the uptake and effectiveness of the inhaler you are taking. All spacers should be cleaned every 2 weeks with soap and water and left to air dry on the draining board. So, what are the benefits of using a spacer device with your inhaler? Well, a study by the University of Kentucky found that when an inhaler is used alone, medicine ends up in the mouth, throat, stomach, and lungs. When an inhaler is used with a spacer device, however, more medicine is delivered to the lungs, and therefore it's going to have a better effect on your breathlessness. There are also a number of tablets that can be taken to reduce breathlessness. Theophylline, such as slow-filin and unifilin, are bronchodilators used to treat wheezing or shortness of breath caused by asthma, bronchitis, emphysema, and other breathing disorders. These work by relaxing the muscles in the lungs and chest, making it easier to breathe. They also open up the small airways. Mucolytic drugs such as carbamazepine and erdosine and Naxis break down sticky mucus. The mucus or sputum in your lungs is held together by certain bonds. When these bonds are broken, the mucus becomes less sticky and less thick and much easier for you to cough up. Leukotriene receptor agonists such as montelukast work by blocking chemicals that cause inflammation and swelling in your airways and keep them nice and wide so that you can breathe easier. And steroids such as prednisolone also work by decreasing inflammation and reducing the activity of the immune system in your lungs. Rescue medications. Depending on your respiratory condition, you may require a rescue course of antibiotics and/or steroid therapy. These are to be used in conjunction with your self-management plan. Nebulized therapies, like inhalers, also come in different forms. Short-acting bronchodilators, like salbutamol, Long-acting bronchodilators like ipratropium bromide and steroids can all be obtained in nebulizer form. And certain antibiotics are also available. This slide shows some of the nebulizer equipment that is available to you. Important things to remember. It's extremely important that all medications are taken as directed, as this will ensure the best possible symptom relief. The need for mouth care is also vital after taking your inhalers, as this reduces the risk of oral thrush or dry mouth. Checklist of things that we need to be aware of when we're taking inhaled medications, tablets, or nebulized therapy. 1. Be aware of the role of your medication. 2. Know how to use your inhaler properly. 3. Know how often your medication should be taken. 4. Be aware of the side effects of your medication. And 5. When you have started a new medication, ensure that you attend a follow-up appointment to discuss its effects and any problems that you may have encountered. It's important at this point to make sure that your GP or your nurse are aware of the situation.